Greetings, and welcome to another mastermind session from Chamberlain University, where we discuss topics and experiences to help advance the healthcare community. Domestic Violence Awareness Month is held throughout the month of October as a way to bring advocates across the nation together to end domestic violence. In recognition of Domestic Violence Awareness Month, our topic today is titled, Love Doesn't Have to Hurt, but what do you do when it does? All of our panel have a connection to domestic violence, whether it's serving in a role counseling survivors or supporting loved ones who have suffered at the hands of an abuser. They'll share information today that can help educate and activate healthcare professionals and bystanders to create a culture of caring for victims and survivors. Now let's introduce our esteemed panel. First up, we have Latrice Mosley Smith, affectionately known as the Ice Cream Lady. Her background is in the criminal justice field and social work, but her true passion is entrepreneurship. As the owner of Hot Fishnet Hosiery Collection, her products have been worn by celebrities and everyday women across the U.S. and Canada and featured in print media. During Domestic Violence Awareness Month, she hosts the annual Purple Hose and Heels 5K charity event with proceeds benefiting a local domestic violence shelter. This is held in honor of her mother and the abuse that her mother experienced from her father. Additionally, she created the Hose and Healing Foundation, awarding scholarships to high school students that have been affected by domestic violence or have been in an abusive relationship. She serves as the executive producer of the hit stage play Survivor's Monologue, which is based on her personal experience with domestic violence. She also serves as the director of Love Shouldn't Hurt Ministry for those who are healing and helping others with domestic violence issues. Please welcome Latrice Mosley Smith.
Thank you so much for the introduction.
Thank you. Next up, we have Dr. Kiana Battle. Dr. Battle is a licensed master social worker, and she received her PhD in social work policy planning and administration from Clark Atlanta University. She also received a BA in sociology and an MSW degree in social welfare from the State University of New York at Stony Brook. Dr. Battle is a professional social work consultant, and she currently serves as an assistant professor of social work at Chamberlain University. Her professional area of practice is school social work. She served as a school social worker for over a decade in both New York and Georgia, as well as the Director of Program Services for the Georgia Department of Corrections. She's been a featured presenter at several national conferences, including the National Youth at Risk Conference and the National Association of Social Workers Conference. Please welcome Dr. Kiana Battle.
Hello, and thank you for the introduction.
Thank you. And last but not least, we have Dr. Katie Kay. Dr. Katie Kay is the Senior Director of National Academic Programs at Chamberlain University and is responsible for providing leadership to university-wide operational and quality initiatives. Dr. Kay has over 15 years of experience in the nursing profession, specializing in critical care, emergency medicine, healthcare system operations, nursing administration, and academic operations. She holds a Doctor of Nursing Practice degree after earning her bachelor's and master's of nursing science. Please welcome Dr. Katie Kay.
Thank you so much. Happy to be here.
Thank you, panelists. So let's go ahead and dive right into this topic of domestic violence. As I mentioned in the introduction, all of you have a connection, whether it be personal or through your life's work. So let's just set the stage here and I'd like for each of you to give your definition of domestic violence. And let's start with Latrice.
Yes, when I think of domestic violence, two words come to mind, and that would be power and control. The behavior which sets the tone is that of a narcissist. That individual is not going to change his or her behavior. Every month, as it creeps up to October, I always do my research just to find out what other types of categories are being put in types of abuse. We are all familiar with the physical, the emotional, and the psychological. But what I've learned every time it's that time of the month in October, I see that they've added other types of abuse. The financial abuse, when the abuser holds back on monies for the abused individual to even live. What's new that I have not heard of, and maybe the other panelists can chime in on it, is reproductive coercion. And that's basically a refusal of using a condom, monitoring menstrual cycles, puncturing a condom. That was definitely new for me. And the other new one is digital abuse, them monitoring their social media and finding out who they're friends with and telling them who they should not be friends with. So this is interesting, and I'm glad to be here to learn even more. So I will let the other panelists give their definition, but I definitely want to find out if they were familiar with these other two types of abuse that I just researched on.
That's a great way to set the stage, because like you said, the definition isn't just one gender or one type. There are multiple ways that people can be abused, like you mentioned, whether it's digital or reproductive. So let's get to Kiana and let's get your definition of abuse.
Thank you, Aisha. And Latrice, you're absolutely right. The root of domestic violence or intimate partner violence, as is said from the National Association of Social Workers, and or family violence, the root is power and control. So in any domain, even the domains that you mentioned in regard to digital abuse, reproductive abuse, things of that sort, the key still remains power and control. And that's the gist. When one partner exerts power and control over the other, and also to maintain that. And so that's truly, what it is. We know in domestic violence work, the power and control wheel, it has all the different domains of where that particular perpetrator can exert power and control, whether that be over the finances, whether that be over the reproductive system, whether that is, over the digital domain. So I appreciate you indicating that. And I'm sure there's going to be so many more domains added to that.
Exactly.
But the root is power and control. So thank you.
Awesome. Katie, what would you add to as far as your definition?
Well, gosh, they really highlighted pretty much all of the key concepts that I would speak on. I would use one additional word, which would be coercion or coercive behavior. We often see that with domestic violence, and just really reiterating the fact that domestic violence isn't just physical abuse. It's all the different elements that have been discussed earlier, which people don't necessarily see or recognize as being associated with domestic violence, which can be very challenging when you're working in a healthcare setting or a setting as a social worker and you're working to try to identify if that is occurring for that individual. I like that we brought up the financial element. We're seeing that more and more. I'm particularly worried about that too with the pandemic and everything that we're seeing right now with people being at home with their domestic partner more frequently. And then the other portion of that too with the digital media surveillance and sexual abuse that we're seeing as well, not necessarily being tied to domestic violence previously. So great discussion and definition so far.
Katie, you touched on a very important point. Economics definitely plays, as you mentioned, due to the pandemic, people are unfortunately trapped with their abusers. They may not have access or means to escape that because of the depressed economic situation. So that's definitely something that's challenging and increasing the incidence of domestic violence that we're seeing during the pandemic. So thank you for bringing that up. So let's kind of talk a little bit about how does communication, interdisciplinary communication, how has that improved to address domestic violence? So if you think about a time before, whether you were in social work or healthcare, and Katie, you just touched on this, how have the means of support improved, and what are some additional ways that they can improve to help those domestic violence victims? Katie, I'll start with you.
Sure, no, I'm happy to take the lead on this. I think one thing that we started doing well as an interdisciplinary healthcare team is starting to ask the questions. So, and getting smarter about how we're asking the questions too. Previously we would, kind of dabble with what's going on at home, and we may do that in front of the loved one or in front of the domestic partner without taking into account that person likely wouldn't be speaking up for what's really truly going on. We ask very direct questions now with the patient alone, one-on-one, without any family members in the room, so that they feel comfortable to talk. Those questions can include, is anybody hurting you at home? But we also have a little bit more education and training to note or identify some of those other elements of domestic violence that we've touched on already. I think that's one thing that we've improved upon. The other thing that we have also improved upon too is expansion of our electronic medical records and the ability to see charts and records from other healthcare systems too when we're working with patients that may be moving from hospital to hospital, even emergency room to emergency room, to get services and not going to a consistent place, maybe potentially even for embarrassment because they feel ashamed for whatever reason that they're still in this situation. So those types of things have really improved our ability to connect with patients and connect the patients with the right resources to hopefully get out of this situation going forward. We still have a lot of work to do, I will say that, but we are making good strides in the right direction.
That's good to hear. Good to hear. Kiana, what would you say from a social work perspective? How do we communicate with potential victims of abuse, and how has that maybe improved over the years that you've observed?
Well, I love, Katie set the tone in regard to interdisciplinary with the health professions. We're all helping professionals regardless of our specific area of discipline. But one thing I can say, as a former school social worker, certainly the collaborative approach, I think we've improved gravely, tremendously over the years. Of course, there's always room for improvement. And I highlight school social work only because schools are truly bridging the gap between the home and the community. And I often think when we have these conversations surrounding domestic violence, intimate partner violence, and family violence, the children are often left out. Children are often the invisible victims, if you will, of domestic violence. And that's where the school system can really take the lead in working with community health centers, hospitals, juvenile courts, law enforcement, things of that sort, to really help to identify and to provide holistic services. We know that research says that if you're working in an interdisciplinary team and you're collaborating, the level of sustainability will be greater and a more positive impact on service delivery. And so I think schools truly have a very high lead in supporting, particularly to provide those services to the family and to the children. And so, we talk about patients, we talk about clients, but at the end of the day, the work that we do benefits the full community. And so we are not islands unto ourselves. We have to get outside of our vacuum and collaborate. And that's when you'll have the greatest impact on service delivery and a healthier community. And I think we're all in the business of having thriving, successful communities, but we've got to walk and work together, across disciplines. And I think we're starting to do that. And as was said, certainly there's room for improvement.
Awesome. No, that's great. You're right. It takes a holistic approach to solve any issue as large as domestic violence, right?
Absolutely.
Latrice, I'm going to come to you with this next question. Have you experienced it in your work with survivors? No, it's okay. In your work with survivors.
With something that Kiana just mentioned.
Oh, go ahead.
Absolutely correct, because I was a child witness and I didn't have resources. I had individuals teasing and taunting me when they would see my mother with the black eyes and wearing the dark glasses at nighttime. They would laugh when they hear my father yelling at her as if she was her child. And I never had that that feeling of being a daddy's girl because I didn't know what that meant. So the children are totally affected. And if there were resources back then, I probably would have been a little bit better knowledgeable, but now I am, because I know people don't want to go to counseling, but counseling is what saved me and my emotional scars. So I'm sorry to interrupt you, Ms. Margaret, but I had to just chime in on that because they're forgotten about. They never know about what the children are going through.
I'm so glad that you shared that, because that actually leads right to my next question. So my question was for you, and you talked about it, experiencing a bias. Let's talk about that bias and that judgment that survivors and victims do experience in the community. You talked about it with your mom. Have you seen a change in that? Have you seen more support in the work that you've done since you became an adult? Have you seen a change in that bias that abusers experience?
Well, we all know that domestic violence is the taboo topic. No one wants to discuss it, okay? So what I can honestly say that is expanding now, and I don't even know if we're going to touch on it, but there is abuse going on in the church. Mm-hmm. And we go to church every day, and you could be actually going to church with your abuser. What I'm finding out is people are not as judgmental as they used to be, because we all know, what is that question that we hear? Why didn't she leave? They don't understand what a woman or man is going through. And it's not that easy to do. It's easy to say the words because I witnessed my mother leave multiple times. We were at my grandmother's house and back, at my grandmother's house and back. Until one time my grandmother said, she's going to stay here with me. And it was not until my mother realized that she was going to lose her child because she believed that this individual would change his behavior, which he has not. So when you say, has society become more compassionate? In a sense. And what I can see is that there are more resources that are out, especially since my mother has been, an abused woman. She didn't have someone to go to, but there's so many different agencies. There is new bills that are being passed. And just with the pandemic, the title of the 5K is Remembering Those That Have Been Forgotten During the Pandemic. There was also $1 million given to agencies during the pandemic by the governor. So if you say, yes, it's getting a little bit better, I would say it is, but we still have a long, way to go.
No, thank you for sharing. I know. Katie, how about you? Do you feel like bias over the years as Latrice said, there's more compassion for victims? Has that progressed, or do you still see that shame that's placed upon people who experience domestic violence?
I do. I think there's a little bit of both. I think that we are getting better and more compassionate with those that are experiencing domestic violence. And moving away from that mentality of why didn't she just leave, or why didn't he just leave? There's a lot of variables that go into that. And I think we are understanding that even more now as women, as more and more women are in the workforce and managing multiple different priorities too, that things are a little bit more complicated and have a little bit more empathy for those that might be in those situations. I will speak to you on one more bias that I think is prevalent, is when we hear the term domestic violence, we often think women and only women, because women are much more likely to be impacted by domestic violence. A lot of our statistics show 1 in 4 women will experience some sort of domestic violence at some point in their life. But what's also interesting is about 1 in 10 men also experience some form of domestic violence. So I think overcoming that bias as well too, and being more open to talking about it, not just with women, but with men as well, particularly when we start bringing in all the different dynamics that fall under the domestic violence umbrella, considering digital surveillance and those types of things. I think we'll move forward or further along if we're just continuing to have that conversation more openly and freely with each other.
Yes, I definitely think that education is key, because you're right. I'm sure a lot of people aren't aware that 1 in 10 men experienced domestic violence. I mean, even I was participated in a panel earlier this year, and there was a gentleman, and he was in the he had been in the military, and he talked about how his wife abused him and he needed to leave his wife. And it was something that he normally didn't talk about, but now he wanted to talk about because he wanted people to understand that there just weren't women who experienced domestic violence, that men experience this too. And they need to talk about it because they definitely tend to not talk about that.
And let's not forget the same sex. That is increasing now.
Great point. Great point.
Excellent point. Excellent point. Kiana, what would you add about, from a social work perspective, do you believe that bias towards victims or survivors has decreased, and that we're making progress in that area?
I would say, Aisha, we're making progress, but as was said, there's always room for improvement. I think Latrice said it so well as Katie. The reality is there's a taboo. And then when you put on the cultural lens, everyone's cultural upbringing is very different. And so you may hear from certain cultures that what goes on in this home stays in this home.
Exactly.
And
right.
It's such a hard concept to really wrap your mind around for those of us who may be in healthy relationships, but we've got to empathize. And so you can only imagine what a survivor of domestic violence is going through, because this is someone you've dedicated your life to, someone that you love and someone that says they love you. And we know the topic is love shouldn't have to hurt, but what happens when it does? And we know that it does. So my point is, we've got to be more embracive to those who come out to seek resources. And I can only speak from the social work vantage point, but it's not up to us to judge because we can't reconcile, because that's not the shoes we walk in. But we've got to be empathetic because it takes a courageous person to reach out for resources. And so when they do, they need to be welcomed with open arms because it takes a lot to talk about what's going on in your home. And so, yes, I think things have progressed, but we still have a long way to go because I think there are embedded biases, not just from the gender standpoint, but also from a socioeconomic standpoint. Sometimes helping professionals can project their biases onto individuals who come to services and just assume that domestic violence is only impacting those of a lower socioeconomic standing. Mm-hmm. So if you're a helping professional that comes with your own values of what things should be, then you say, oh, well, they deserve it, or, oh, why don't they leave? Or, they should go to school and get a better job. But things just don't happen that way. You look at things like an onion and there's several layers. And so in social work, we are trained to meet the client where they are. And that's what people need to do. We have to embrace the fact that someone reached out for help and be very mindful not to project our biases and internal values onto the clients and patients that we're helping. And I think that's being a professional who's competent and a professional who's ethical. Thank you.
I love it. Yeah, definitely. I love that piece about empathy, putting yourself in someone else's shoes, because it's not about what you would do in that situation. It's about how can you help someone else and support someone else in that situation. Let's not make it about ourselves. Let's make it about how we can support and care for those experiencing domestic violence, right?
Absolutely.
Kiana, I'm going to stay with you. And you touched on it on your answer a little bit, but how would you talk to, or what advice would you give to someone who is just coming within the social work profession and how they encounter or deal with those who are dealing with domestic violence? You talked about empathy, which is so important, but what other advice would you give that person?
So again, I'll start with and I'll just add a little bit. I'm a little bit biased in regard to the profession of social work because I am very passionate about social work and have dedicated my life to educate others on becoming competent social workers. But in social work, we have a code of ethics through the NASW Code of Ethics, and there are certain competencies that social work professionals should have and follow. And so I would first say, one, as I said, we're trained to meet the client where they are. And so regardless of your vantage point in life, as a professional, you're coming to support the client. So you're going to meet them where they are. Okay. One, you're going to, as we said, be empathetic. You're also going to make sure that if you do have any internal biases, that you take time to self-reflect. We're humans. We have different upbringings. We have different sets of values. And so I think a competent professional will do some of that work to ensure that they're not projecting their values onto their clients. Another piece of advice that I would give to new social workers, I would certainly say a no judgment zone. I think it's important. Again, it ties back into meeting the client where they are. This may not be something that you would do in your life, but you're not this person. You're here to help the person. And I would leave this. It may be that I should start with this, but I'm going to end with this piece in regard to new social workers. Always lean with the client's safety in mind. I think it's very important that we ensure that there are safety plans. We can't just come up with arbitrary things for the person to do who's being impacted by domestic violence, because we know the chance for violence increases and potentially death when a survivor attempts to leave a relationship. So I think safety has to be key. And so some social workers or professionals, you may be new in the field and so eager to help, but you've got to make sure that safety is the number one priority when you're working with those impacted by domestic violence.
So true.
Definitely.
Thank you, Kiana. Well, this has been truly an enlightening conversation. I think even I learned some things that I didn't know, and I felt that I was somewhat educated on the topic. But as we close, I'd like for each of you to give your final thoughts. What would you like to leave the audience with regarding this topic as we close our conversation? And I'll start with you, Latrice.
I would definitely say that it is time to end the silence and stop the violence. If you see something, say something. Do not always believe that it's easy. Some victims just need someone to be a sounding board. They need someone to listen to them, because you have to remember, they have been isolated from their friends and family. So when you come across an individual like I do, I get inboxes from Facebook all the time and emails, because they have no one to talk to, because they are ashamed. They feel embarrassed. So it's not for us to tell them what they need to do. We need to listen, and then we need to assist them with trying to do what they want to do. We can't get out of that situation for them. Right. They have to come to the conclusion, just like my mother, when enough is enough. And I honestly say, when I am at church and I see these couples that are sitting next to each other, but the wife had been in my session for a whole month, it hurts me, because she's sitting next to her abuser and no one in the church knows. Mm-hmm. And she needs a plan so that she can exit successfully and be safe when that happens. So, but I would just want to say, if you see something, say something. You can save a person's life.
Oh, thank you. Thank you. That is so true and so impactful. If you see something, for sure, say something. Katie, what would you share? What would be your final thoughts today?
Well, gosh, that's really impactful and somewhat hard to follow. And the only thing I would also say behind, if you see something, say something, is and reserve all judgment. Because if they're willing to speak up at this time, it doesn't matter if it's been happening for 5 years or 5 days. What matters is that they're coming to you now for help. They're talking about it now. So be there for that person. And just as was said before, say something. And that's all I can really add to that. That was just so well said.
It was so well said. But you're right. We have to, as we talked about those biases, we have to set aside our own personal bias and help and support. Kiana, what would your final thoughts be?
My final thought would be to just make sure that children are no longer the invisible victims, certainly having a heart for the children involved in these situations. I think as practitioners and professionals, we've got to be mindful to service the whole family from a holistic approach. And we know that children who experience traumatic events oftentimes have challenges coping with those. And so if we can identify and do some of the education and interventions early, we can help children to have successful, thriving lives, to provide them with more positive coping strategies to address some of the trauma. So I would just say, make sure that we're not leaving the children behind. I think that's very important. We've got to make sure that we're taking care of our children. And so that would be my final thought. Thank you.
Amazing. If you see something, say something. Reserve judgment and no child left behind.
Exactly.
So that was wonderful. Thank you so much, panel. I appreciate you providing your expertise, your personal experiences today. I know they resonated with me, and I know they resonated with our audience as well. Thank you so much for everyone for joining us for another mastermind session. Be sure to join us for the next session, which is next Wednesday at 1 p.m. Central. Thank you again, panel, and thank you all for joining us. Have a great day.
Thank you.